Concussions have been a part of sports since the inception of athletics. Only recently has there been an increase in awareness of the impact of concussions on the neurological pathways of these modern-day gladiators. The National Football League is the most popular sport in America today. It is also considered by some to be one of the most violent. Last season, a total of 159 concussions were reported in 16 weeks of play. This averages to 9.56 concussions per week and 0.62 per game. The incidence rate of a concussion for a team with 33 players was 15.06%, and 12 players ended up on injured reserve as a result. The National Hockey League also shows alarming statistics as well. 1.2 concussions were reported per game night, and 14.2% of the active NHL roster was concussed. These figures raise concerns about the effect of concussions on the brain and surrounding neuronal tissue in the short and long-term basis.
Concussions are a form of traumatic brain injury. They are caused by impact to the head, resulting in motion of the brain. The movement in the skull causes axonal stretching and can even cause axonal detachment and eventual neuron death. As the brain is jolted upon impact, axonal connections can become stretched to the point where connections sever. Normal CT and MRI scans cannot detect neuronal damage caused by shearing of axons. During injury, most people have symptoms of headache, blurred vision, dizziness, sleep problems, subjective memory problems, and other cognitive difficulties. These can persist after initial impact for several days or even weeks. When all of these symptoms no longer remain, it is thought the brain is fully recovered from the injury. This fact is correlated to the often favorable course of post-injury recovery in most mild cases of concussion. These mild concussions usually result in little to no loss of cognitive function in most patients. Most people suffering from these injuries feel normal within 1 to 3 weeks. However, after a severe concussion, there can be a heavy negative effect on cognitive function because of loss of neurons in the brain or slow recovery from injury. Because this injury is common in athletes, studies have been done to see what exercise during recovery can do to concussed individuals. From these studies, it is recommended that athletes should rest until they are asymptomatic. Once in full cognitive function, return to light exercise is recommended, with slow progression to full physical activity. However, more research must be done on the effects of short, medium, and long-term exercise on concussed individuals. Exertion theoretically can cause changes in neurometabolism that may affect neural recovery and activity. Because many athletes choose to compete as soon as possible, they may attempt rigorous physical activity before fully recovering. This may induce second impact syndrome, where a concussed individual experiences a second impact to the head before fully recovering from initial concussion. This can cause severe swelling in the brain within minutes of the secondary impact. Swelling of the brain has been known to induce a comatose state with respiratory failure, rapid eye movement, and dilation of pupils. It can cause death as well. Post-injury, most people feel that they are at full cognitive function after initial concussion symptoms disappear. However, it has been seen through MRI and CT scans on concussed athletes that there are functional and structural abnormalities in the brain after symptomatic recovery.
It was shown that supplementary and pre-supplementary motor areas have decreased activation after concussion. This was mainly seen in individuals who lost consciousness and was related to lower reaction time. Others have seen a decrease in activity of the frontal cortex and had increased parietal and temporal activation. Normal axonal connections in the internal capsule are shown in yellow, and corpus callosum in red. White matter integrity in the corpus callosum and internal capsule of the brain were measured within 24 hours of injury. Researchers found integrity lowered in both areas of the brain. Measurements 1 month after showed neither the corpus callosum nor the internal capsule fully recovered white matter integrity, even though patients were asymptomatic. Further research is needed to see longer-lasting effects on the brain. It is important to stay vigilant in post-concussion recovery to assure that the brain is allowed to heal properly. Returning to the field of play before a full recovery could have potentially damaging consequences. The safety of our professional, amateur,
and recreational athletes requires that we treat them with the utmost care when one suffers a concussion.